Hello, everyone, and welcome to this new episode of Mind the Gap podcast. My name is Dima. I'm today's host, and I have today with me Dr. Safa Somi. She's an implant surgeon and a specialist prosthodontic lecturer at Eastman Dental Institute. Safa, welcome.
Thank you.
Safa, I would like to start with a question regarding your life journey. So, would you be able to tell us in a couple words, how did you get where you are today?
Okay. I'm originally from Iran, and I did my dentistry training in Iran. And after finishing dentistry, I did like equivalent vocational training. Then I decided to come to UK to do my specialist training. So I moved to UK, did my specialist training, and then continued to work in university environment and in a private practice. And now it's been a few years that I'm doing both a lecturer job and being a clinician and, as you mentioned, implant surgeon and prosthodontist.
Fantastic. Did you find difficult moving from one country, one educational system into another country to another educational system? How did you find this transition? Did you adapt quickly?
Transition was a bit journey because when you study in different country, out of European country, when you come to UK, you need to do a special exam that your training will be adapted or accepted by General Dental Council, which was a exam that you need to go through. It is a difficult exam, but for me, because I've done my specialist training at the same time I did the exam wasn't difficult. But thanks to my training in Iran, which I had very strong foundation there, when I moved to UK to do my specialist training, I didn't feel that I'm anything behind UK qualified. Actually, in some area, I felt more stronger because in Iran, the training, we follow the American way. But anyway, both they are good. So in terms of my knowledge, I didn't have any problem. But adaptation to the NHS system in the UK, do this exam equivalent to get the qualifications. The journey was long, like the politics and these things. And need a little bit of grit to be able to go and pass through it. And after that, getting to specialist registrar, at least in GDC, that was another journey. But yeah, all of them done. And after that, you can get a bit of a peaceful life.
You told me before the start of this episode that basically getting a space in the undergrad education in Iran is quite difficult. There is a big competition on those places, right?
Yes, lots of people, they don't know about this because in Iran, going to university to get like a good education in medicine, dentistry, engineer, you need to be like a top 5% of the dental, top 5% of the students. So since childhood, really you get trained to pass this difficult exam at the end of your high school. And it's really high competition. All the parents and children, they investing a lot of their time and money for their children when they grow up to go to the higher educations. And that was one of the toughest things that you do to get to the a public school and to become a medic or a dentist or engineer in Iran.
It's funny because you see these exams in China. I think that's quite similar. So university degree is very important there and the competition is so big.
Yeah.
So sometimes it takes a toll. So I suppose after being taught this lesson of resilience in Iran, it was probably easier for you to
much
adapt
easier.
Much easier.
And it become when I came to UK, do my postgrad training compared to the a UK qualified, I felt like okay, it's something easy for me because it's what I trained in Iran and the toughness and difficulty we had compared to here was nothing. But for UK grad was a bit more difficult because they didn't have this hardship in their training like in Europe or UK.
Was it difficult being a woman, coming from another country and trying to find a place within the educational system in the UK?
I think, generally speaking, being a female is a little bit more difficult than male in terms of acceptance, adaptations, and then you feel that you belong to a community. But I'm not saying that male are more privileged, but always there is more openness to male compared to the females, and unfortunately still there are some aspects that male come as a first gender compared to the females. But
Is it
honestly,
because of the industry specific? Because implant dentistry, I'm talking here about just implant dentistry because prosthodontics is probably different. But in implant dentistry, which on oral surgery at the same time, it's a surgical domain which involves blood and cutting. So it involves sort of more aggressiveness. So do you think it's because of that?
yes, surgical part, I think that everyone has this perspective or perceptions that is male job. Females, they are more gentle, they are fragile, so they don't need to deal with blood and this thing. Even I remember in my undergrad training, when I went to a surgical field, all of them, our male professor and tutor say, "Oh, female, be careful, you don't faint. You see the blood." It's just the thing that, okay, that if you see the blood, you will faint. And that's made it kind of become as a culture that male has to go to the surgical part and female has to go to more restorative part.
It's funny, but if you know or if you spend any time on YouTube, you'd see probably more videos of husbands fainting where their
Yes,
wife gives birth
exactly.
rather than women fainting when they see blood.
True. Yeah,
That's
that's I
funny.
think is wrong because we had even our male colleagues that after giving the local anesthetic to the patient, they were shaking and they couldn't is a nature of
That's in
human
the
beings.
postgrad.
Yeah. So is being implant dentistry for or a surgery for a male, I don't think so is true and it's changing because there are lots of female that they have discouraged and they are not scared of blood and actually they are more careful and caregiving to the patients compared to the male.
But
And
you know, there is already a well-established science data, research data, psychological data that says that the main difference between women and men in terms of occupational is interest, because men are interested in things,
yeah,
in toys, in objects, and women, females, are most interested in people. So what you're
true.
saying, you're trying to care more about the person in front of you rather than about the procedure itself. Is that roughly so?
Yes, it's true because as a female, being a female generally, they care for their when they are young girl. They care about their siblings, is their nature. Even they care for their dads, and then they grow up. They become a mom. They become a sister. They become a caregiving. So it's in their nature. Same thing with the patients. They treat patients first as a human being, have their emotions, dealing with the whole treatment plan as dealing with the patients. But they say boy with their toys, and they are different. So that's they check about their equipment, instruments, how they approach the a treatment plan as a way of solving the problems or dealing with the problem that patients have rather than patient as a human being. So
How
there are
does that
different.
shape actually the clinical approach to a case? Let's say there is multiple approaches, clinical approaches to every case, and some approaches are less invasive, some are more invasive. How does this being a female shape your clinical approach?
I think one aspect being female and the other aspect being having different knowledge as a specialist. So when you're specialist and female, you have a broad view of everything. So you take the knowledge of, okay, this, for example, the gap with dealing, is it only gap or is it whole mouth or whole and being a female, whole human being? So you have this holistic approach of the treatment planning, which you consider the patients first as a human being. What are their needs? What is the best way to treat these patients? Be less traumatic, more conservative, and then consider all the aspects of the treatment. Then you go to the a treatment. There are different ways, as you mentioned, that it can be a complex way of grafting, waiting for 9 months, then going placing implant, or the other ways of doing that. Okay, can we avoid doing a complex grafting, place different implants, different positions? There are different approach of doing that, and I think that is all depends that who is the one is deciding. being gender has some effect, but I think that is more skill and knowledge that's driving the treatment plan. And then in terms of the delivering of the treatment, it's just like a more female touch, and then considering patients' wishes as like a way of dealing with the treatment. But generally speaking, I think that patients, they are driven by clinicians in terms of what we advise them, because they don't have any knowledge. If we tell them, okay, you need to have this advanced grafting, that's okay. It's the thing that you think that is the best way, they will go. But some, they might be scared and never go through this treatment because they are scared of having this advanced grafting, even with the sedations. So they may not never go through this approach in their life and accept the gap. However, if we tell them, okay, there are different ways of doing that, the best way will be, for example, this way, but it will take longer, it's more complex. There are different ways of doing that. If you don't want to do it, there are like a simpler way as well. So we need to...
For example, the lasers. I know that you're a laser
Yes.
user, and that has a lot of approaches in delivering pain-free or less pain-free surgeries.
Exactly. Nowadays with technology, it changed a lot. So laser, it helps patients massively in terms of management of the pain, and with this photobiomulations in terms of regenerating, reducing the
bleeding,
inflammations after that, and creating like a more helping patients' biology to produce like for example, more bone, reducing the healing time. So these are the stuff that, again, back to the basics, skills and knowledge of the clinicians, that they can provide this to the patient, information to patients, and there's okay, now the thing has changed. Or like now with all of the digital technologies coming, reducing the surgical time with using the technology, and reducing the less need for more complex treatment with the technology that we have. So actually, this is really interesting, because since I qualified and I did my specialist training and become an implant surgeon, till now, each year I see that the development is happening, and my approach 10 years ago was completely different than today. Because
tell me, I was interested. This is actually part of my my program. What has changed since you started doing implants and restoring them years ago to what you're doing now?
Actually, it's a lot, and that is make me so excited still to every day. You say, okay, I'm not bored of what I'm doing, because the pace that technology bring to the implant dentistry, or not the only implant, in dentistry in general, is mind-blowing. Even evidence can't catch up. I'm in an academic environment, so I want to, when I'm providing the lecture to my postgrads, so I want to be evidence-based. But the technology is there, still we don't have the evidence. By the time you want to do the research and bring the evidence...
That's a very big topic. I've been in a lecture right now, and somebody said that from all the research topics published online forever in the field of implant dentistry, you could probably wipe out more than 70% of research that are not valid anymore.
Exactly.
And actually, if you'd have to pick up just the research that is meaningful, is just 5%. And indeed, when you bring something to the market, you've got the technology.
By the time you want to publish a paper, a new technology came, and that is...
We don't have the luxury of Bronimark when he came at that congress, a legendary congress in Toronto, presenting 15 years of data, which was shocking. I mean, it's still, I don't think it's rivaled being able to launch a product with 15 years of research.
Yeah, that's very different. For example, in my training, we had textbook. They will our reading list. Okay, this textbook that you need to read. But now we can't tell our postgrad textbook, because textbook is so old. By the time it's published, there are loads of other new articles coming to publication that they need to read.
That was the situation with immediate placement and immediate loading as well,
Yeah.
right? Because still in the textbooks is a procedure that they wouldn't recommend.
Exactly. When I was doing my training, it was a big no-no. You shouldn't do that. And the amount of the like a bone you have, or like putting a chunky big implants in the gap, and then after a while you see all of the recession. It's completely different. You couldn't place the implant when there was a like a periapical pathology. It's just like a big introverse to do that.
Indication.
Yes, sorry. But now it changed a lot. And even basic thing that about implant success and survival. If you look at the evidence, if implant exists in the patient must consider as successful. But now there's no patient doesn't accept bone loss around implant as a successful. And we as a clinicians, we call it as a failure, not success. So it has changed a lot. And especially now with the advancement in AI, treatment planning, like smile design, having my prosthodontic hats on. So we do the treatment planning based off prosthodontically driven. And now we have all this help of with the technology. We bring the patient's face to the area, so facially driven planning. We have the face, we have the smile, then we have the prosthesis. Then we go to placement of the implant, which is the last thing. So we can visualize all of them three-dimensionally. Like we can see that the patient is talking without having, the patient doesn't have teeth, but we can visualize it have a teeth and talking, and three-dimensionally we plan everything, which is really mind-blowing and is exciting because you get more involved and doing the stuff and you never get bored of your everyday dentistry.
Amazing. There is so much technology that have not yet filtered through to the individual practices yet.
Yeah.
But what you're talking about, being able to digitalize every single piece of diagnostic information from the intraoral information and then the CBCT and then the facial scan and being able to compose this in a single digital avatar and being able also to analyze the CEF information and implement it in the same model, which will give you all the as a prosthodontist, all the relevant information of where the prosthetic should be. That's amazing. And as a marketing tool for the patient, because you show him this is how you can look in 6 months.
Exactly how it be done. And real life surgery. Now, we have guided surgery, which help massively, but real life now, robotic surgery, and you can visualize and do the surgery.
With the robotic, though, I think there is still a long way to go. I think there is some robotic surgery companies in the world, but they still have a long way to go to be helpful.
But they are like a static way of doing the surgery, which is more routine now, but robotic is still, way to go.
So what do you think immediate placement and immediate loading did for the industry for the last 10 years?
I think it changed massively. Myself, if it's possible, I do immediate because you preserve all the tissue structure. So we don't wait for losing the hard and soft tissue and then go and rebuild it. So if we can preserve it, we will do it, which previously in my training, take the teeth out, wait for healing, then advancement, do early placement. Still with early placement, you lose some structure. But if you want to do a favor, if possible, preserve whatever patient has and then augment it at the same time to not lose. Obviously, there's a biology is losing, you will lose some to some degree. But previously, we didn't have long-term evidence. Now we have long-term evidence that shows that success of the immediate implant in different aspects is equivalent to the more predictable things. Other options like, for example, early placement, but give extra advantages like you preserve the tissue structure, the timing, patient's comfort. So it's different. It still is not for every single case, but it changed the implant dentistry a lot. And in terms of a generation that we are dealing now, that they are like Amazon Prime generation, that they want everything. They see it and they want it. And then you can't tell patient, let's take your teeth out. Then because of the infection, you lost loss of bone. After 6 months, let's do the graft, wait for 9 months, then come back, place implant, wait for another 3-4 months, then we place the provisional. Then the journey will take a long time, and lots of patients, they won't accept this. They want something big, especially in aesthetic area. They have a representative of the tooth that they can do their everyday function. But at the same time, as a clinician, we have to have a duty to tell them their risk and advantages. And if it's in their best interest, why not? That would be the best option. But sometimes, unfortunately, we can't. And there are some limitations.
But do you think this knowledge, the things that you're doing in private practice, Do you think this knowledge is filtering well enough into the academic? You said that in the textbooks it still says that this is not the recommended approach.
Yeah, it's in textbook, but articles coming, the publications that come in,
So
they
you're
are
not
comparing
bounded
it.
by textbooks?
No, not bounded by textbook. Like when we're doing the lecture, we just check in the latest publication. Publications, they are evidence-based. They show, okay, that they are good result. In terms of like still we are waiting for more publication in terms of like a tissue preservation that we don't have the long-term data. So at least we want to have 5 years data and longer better. But as we mentioned earlier, with all the advancements, we won't get the 5 years. The new things is coming. I'm now even adding the growth factors in the like regenerations. Consider the patient's biology and work with the biology. Previously, in my training, like 10 years ago, biology wasn't that big things. But now we respect biology. We choose our biomaterial, implant systems, size of the implant based on patient's biology, which is we don't have a very long-term data, but everything is going through that directions.
How do you go about selecting, for example, your providers, your biomaterials provider, not provider, but it's just the product. So the biomaterials, the implants. How do you get to see whatever fits the needs of your daily practice, or it's a different kind of relationship?
I think that nowadays, because we have all the implant systems, they know to design the implant that works. So previously, we had lots of progress in the designing the implant. Now, most of the implant companies, they develop an implant that is long-term evidence it can work. But we need to select it based on our indication. For example, some systems, they are not designed for immediacy. And although most of the implant systems, they try to have this immediacy, but again, as a clinicians, you need to have this basic knowledge that you know based on the case which type of the implant you require, and you choose your system based on that one. And personally, I think that is apart from having the basic right between the systems, is the support we're getting from the companies as well is really important. Yeah, all implants works, but what our patients and clinicians they get from their providing implant company is
because it's a
different,
whole
right?
body of knowledge inside the industry as well. The whole
Yes,
market evaluates by communication and collaboration between the industry
exactly.
and the dentist, the
And the
dental
industry
field.
that they listen to the clinicians, they know that what are the limitations that they have, and really they implement it and they improve their products, and then they help clinicians. Not like, okay, this is our system, and then they don't want to make any change, or they cost them a lot to do any change. Then clinicians they will go try different systems because.
And this is what you expect in a world that the patients they would like to have their treatment delivered as soon as possible and without any complications. You really have to be on the look on the new
Yeah,
technologies and the offerings of companies and solutions that you can get and
definitely.
apply every day. Like in you're a prosthodontist, a special prosthodontist, so you know that one of the treatments that the concept that have taken the world by storm is the all-on-4,
Yeah.
and it probably one of those concepts that is a life changer. So, what do you think is the status of this concept, of this treatment concept in the world, and what do you think is going to be the evolution of it in the future?
I think it's a great concept, but unfortunately, some clinicians they take it in a wrong way. My worry is that in future, that lots of health cities they're being extracted to have this all concept of all on 4 or all on X, and some of them they could be saved. And luckily, in Europe or UK is not that bad, but I know in some country like States, they do massive bone reduction. They take the health. Not healthy, but the teeth can be safe. Not only take the teeth out, they cut the bone, they cut the tissue, and they place some implants. And each implant has longevity, it's not forever. And when those fail, what will happen? Then zygomatic implant or the other. And when they fail, what will happen? So considering that patients, they live much longer now, we have better healthcare worldwide. So we need to provide patients with the dentition, they lost them till they are alive. So it's I think that full arch is a great concept with the implant, but for the right indication, not for the younger people. Like I see, unfortunately, patients the age of 30s, teeth been taken out and have this all on four. And
You know,
then,
what's a funny story? I've been listening to a lecture by Malone. He told a funny story where he was seeing a patient, and the patient, I think she was a police lady or something. Her teeth were not great, but still were her teeth. And she came and said, I want all on four. And he said, I cannot do all on four for you because you still have teeth. For all on four, we need to extract all the teeth. And she said, okay, so extract them. I said, I cannot do this. Is unethical. So she asked again, you won't do it? And he said, no. So she went somewhere else. She paid somebody to take all her teeth out and then
Yes.
came back to him and asked, now, will you do it now?
Yes.
She said, well, now I'll have to do it. So which is crazy.
I think that is all the clinicians is our duty to give the right information to patients, because sometimes patients, okay, it costs me much less if I take all my teeth out and I have 4 implants at the bridge, but it will cost you much more in long term.
That's a valid question, actually, because if you, I have been through, I didn't need an implant treatment, so mine was orthodontic. But at that point, a lot of this, and I was in the industry, I had a lot of thought, I mean, maybe it's easy just to take them out, just put implants because it will be so much quicker and easier and cheaper. So it's a big question for
Yeah, that's the thing that
patients.
we need like to teach our younger generations in terms of like doing the basic right, having the diagnosis right and treatment planning right, because patients, they don't have the knowledge. They come to you and they trust you as the clinicians. If you tell them, okay, yeah, it will be much cheaper for you, for example, few of your teeth, they are healthy, but if you take them, will cost you less now because we join all of the teeth together. But check the patient's age. Okay, fair enough, if patient's age 80, it may work, but if patient is younger, that patients need the teeth forever. Do you think that you are that good that you can provide the restorations for patient last forever? The natural teeth that's given by God or whatever you believe didn't last them that long because that patient is not
Natural teeth
capable
are
of,
not guaranteed for
yeah.
life. Neither should implants
And
be.
especially those patients that they can't look after their natural teeth. Do you expect them to look after prosthesis or the implant you provide them? So that's why it's very important. Clinicians will be aware of them and give the right information to patients. But if you give the wrong information, patients, okay, yeah, it's cheaper, it's quicker. And some people, they think if the implant doesn't need cleaning, so because it's forcing, and I will do it and much easier, better than my teeth because they won't get decayed.
It's very important, I think, to teach more and more patients in preventive medicine at home. And I know this field also develops quite a lot. Patients can do a lot of things on top or at home. So looking at the other fields like orthodontics, being able to do all of these aligners at home, or also in periodontal control, like the light-activated devices like Lumoral, you can have it at home and make easier the life of the dentist by preparing yourself for a surgery, which you have to condition your gums to reduce inflammation before the surgery, or for healing. So you think that's going to be the future?
Yeah, definitely. I think that is help of the companies as well. It's not only clinicians, like as you mentioned, that preparing the gum. If it's a device is coming, if the protocol is coming, the companies that they can put there in the website. People now, they are more technique savvy. They will go and search and they will find, okay, information's online available, and they will know, okay, before having my implants, I need to prepare my mouth. I need to prepare my gum. I can't have it. I need to quit smoking. And after that, I need to look after my teeth. It's not only comes from clinicians, it comes from the implant company. If it's come from, for example, aligner company or different companies, patients, that they will have lots of source of information, and then it makes sense when the dentist said. But usually, based on experience, patients, they will forget 70% of the information you give them. When they come for consultations, loads of information. And if you tell them, okay, the implant need maintenance, they may forget. But with the help of the companies, they echo your sound as a clinicians, then it will be more robust on patient's mind, and that they know how to.
Do you think it's easier now with how the industry has evolved in the past 10, 15 years since you've been in the UK? Do you think it's easier to do your job right now, let's say in the UK, being an implant dentist, as it was before, both generally as a dentist and in particular as a female implant dentist?
Yeah, it's definitely because more collaboration with the companies, and companies now, they are more switched on. And they see the need in the market. For example, now all the implant companies, they notice that there are more female dentists graduating from dental schools, but they are not doing implant surgery. So first of all,
Expand on these statistics a little bit, because this is something that we always talk about. So when you look at the ratio of female and male in the undergrad, it's like staggeringly in favor of females. But what filters down to the surgical specialty is like single-digit numbers.
yes, that's true. First of all, we need to care for our patients, because the patients that they exist, if most of the dentists qualifying from dental school, they are female and they decide to not do the surgery, what will happen for all the populations that they need implants to be done first surgically to be restored? So this is a big things now is lots of female, they're becoming more educated. And but I think the issue is with the female and not going to the surgical field is they are kind of, as a female, you think that you need to be 100% perfect. To be perfectionist to deliver something. I'm a teacher, I see. I have male students, female students. Females, they want to be 100%
On the
perfect.
prosto.
On the prosto. And
So
that
what is the ratio roughly in the prosto department comparing to the implant department?
it's now, again, female is growing more in specialist training compared to the male. So, for example, in my training, we had more male students.
In prosto?
In prosto, in surgical part, in most of the specialists. So, from ortho, lots of specialists that they were like a ratio was more male to female. But now, not only undergrad level, in the postgrad level as well, we have more female compared to the males. Like my current cohort of postgrad students, they're all females.
Really? Oh,
Yeah,
that's on prosto?
That's on prosto, yeah.
Oh, amazing.
So that's why now they're becoming more highly educated. And not only, and that is make me happy, even in the leadership team. Recently, I've been to Maya Clinic in United States, which is one of the big clinic. And they were giving us a lecture about the history of the Maya Clinic and all of the leadership. So first, initial, like all the leaders, male, gradually female were adding. And the current department of the dental part in Maya Clinic, mainly they are females. So the females, they are growing in all aspects, not only in surgical part, in higher education, even in the leadership. So which is good, that they're catching up with males. Previously was everything like in especially higher educations and surgical part was male. But it's catching up now because female, they feel more confident, they feel more
and connected to the patient.
Connected to patients, feel more supported. But it's still, they are, when I teach my postgrad, then I see that some of them, they don't continue doing that. And when I always
why is that?
They are scared, okay. They think that they have to be 100% perfect to do that. I said that you don't need to be 100% perfect. Just you need to know the basic things right. You need to know the diagnosis and treatment planning. And you never feel that you're 100% ready. You need to do it. But male students, that is okay. I've done the training and they have more confidence. On Mondays that they can go and place the implant, but they feel, oh no, I need to do this, I need to do that. Or my bone grafting is not 100%, or my soft tissue grafting is not 100%. Nothing is 100%. Still I'm learning. Every day I'm learning. So we need to start in some point. We need to have a basic right. We need to have a mentor available. If we stuck that, especially initially, start with mentor. But don't be scared because I'm not 100%. I can't do that. Otherwise, you never do that because we are never not 100%. Even now, after 15 years of experience, still I'm not 100%. But we grow, we learn more. In the first day, I couldn't do full arch implant. In first day, I couldn't do advanced grafting. But year by year, case by case, and every day we learn more. So that's the message I will always give my students. Male students, they grasp it quickly. They are confident they do it.
They're less maintenance.
Yeah, but females are still out there, and they have, but they are well more prepared. When I mentor them, the female ones, they have everything's right, thought about it. What if this goes wrong? But not the male one, but they have more courage. It's just a different personality. And that's why now I think that we have less female, but it's just as a like an industry, implant companies, tutors, other females, and other males. I have lots of support from male clinicians because in my time we didn't have lots of females. They do the surgery, and
Also, hopefully, from the industry can only benefit from having more females in the
yes,
market.
that's the thing that just need to provide these opportunities to female. Also, like to help more female to get involved, I was part of ITI females part, which is International Team of Implantology. So we organize lots of lectures, conferences, or workshops for the female that to see what's their barrier. And most of them, they were intimidated by a male-dominated environment. So they didn't want...
Which part exactly?
In the implant dentistry. For example, when I go to... Now it's much better. When I was a student and after that I qualified, I was going to any dental implant conference, I say 80% male. And you're one of the few females that are there. And when you want to ask the questions that everyone look at you, is this question because you are female, you don't know, or it's just a question as a, like a normal person? And lots of female, they don't like this. When they go to conference, they don't find that they like much more female, they won't go. Or when I start going to like advanced courses, I was maybe one or two females in the like a big class that they are learning the stuff. But that is a kind of like a barrier for females that they feel, okay, they are lonely there. And now it's changing because more female is coming. Younger generation, they have more courage and they will feel like more supported. And we have lots of like good male colleagues that they support female as well, which really want this. I'm not like in a way that, okay, woman implant dentistry or male implant dentistry, everything has to be together. We need to work together to help our patients because now we have more female dentists. Our male dentists, which are older than us, will helping us. So I think the future is bright. More female, they will get to it, but it's the duty of all industry.
How do you mentor? I suppose with having so many students in your programs, how do you mentor them? So it's one thing having them in the university, but after this they have to go in the wild and let's say start practicing. Do you have like a mentorship, informal or formal, in place that would help them, will help them actually to get started?
Yeah, definitely. It's just university start of it, and after that, when they go to the real life, they will need a mentor. So lots of our students, they ask us for mentorships that they do it. So like in implant training program at Eastman, mentorship was part of their program. So they had this access to us as a mentorship. In prosthodontic is different because they can decide to do the surgery or not do the surgery, which I find most of them, they do the surgery because as a...
Which it makes sense.
Yeah, it makes sense because I think that's best surgeon is that the one that they know the prosthodontic part because we see the teeth first and then we place the implant.
Because the patients in the end care about
exactly
teeth,
the
not
outcome.
Implants.
Yeah, you can't place the implant wherever you have good bone, but there isn't in a good restorative place, and then it doesn't look nice, and patients can't function properly. So for that aspect is that it's just you need to have the prosthodontic. They should be able to place the implants, and I think that is really important. And in some countries, prosthodontic only restore, but they get involved in the treatment planning. Still is important that do the treatment planning, but I'm biased.
Being able, it's not even, you're not being biased by being a prosthodontist, is the whole trend from the whole industry. It's having the prosthodontically driven implant treatments.
Yes.
It's because most of the problems that are seen and encountered in this field are mainly from mistakes or miscalculations in the treatment planning. So you just put the implant where it was not in the correct prosthodontic position, and then down the line you will see problems. And there is lots of developments in this field, on the prosthodontic field, as you said earlier. The implants have reached a level where it's not the same as in the past, you know. So you make an implant and this one also integrates better than the other. Right now, all the implants osseointegrate. Yeah. So the difference is made in specific indication. Is this implant better for immediate placement? And that's probably a function of the form. Is this implant better for immediate loading? Which is, again, is a function of both the form and the surface. And then a lot of differentiation between the companies also lies on the prosthodontics side or the components that they design. Like the meeting that we'll be attending soon is about launching a new product, which is a new type of component for multi-unit procedures, which is making possible restorations, zirconia or other material being supported directly or being connected directly to the abutment without the help of a metal interface, which solves a lot of problems because all-on-4 concept don't come without problems. As we know, we have a lot of situations where you have to intervene, and it's not like a 100% success rate.
Yeah, that's true. Just implant by one aspect of it, restorative part, the connections and different abutment, which is really important. Lots of people they know the implant, they don't know much about the prosthetic part, which is
the
most important aspect of implant dentistry.
Amazing. So, the previous speaker, which was also a female, it was Victoria Ivancheva. She's also, by the way, an implant dentist, and she's involved in education. She asked a question for me to ask the next speaker here is, what is your biggest fear and how did you overcome it? And I suppose it's a fear connected to the professional side of your life.
Okay, if I want to relate this to implant dentistry, my biggest fear was or still is the case that because of the complexity or advanced things, I may not be able to help the patients. So when I started first, when I was seeing like a big defects and big surgeons, like for example, Isvan Urban and people like this, I was like amazed that this patient, if comes to me, I need to send them all the way through the Budapest that go to see Isvan Urban. I was just like, I wish that we have more clinicians. But I've been lucky that I mentor with lots of like big clinicians like Isvan Urban and Daniel Buzers or Zukelis, that I try to learn from them, adapt them. And I had a patient that one of my periodontist colleagues referred me, a young lady, which lost a dentition and with the big defects and came for consultation. And my colleague trusted me that I'm the person that I can help this. But that was my biggest fear. When patients come to me, honestly, I said, okay, you have options. Either go to Budapest or just go to Italy, see these big people. I said,
it was for grafting.
Yeah. And she said, no, I'm staying here. Can you help me? I'm not going anywhere. I've been traveling a lot since age of 18. I had trauma. I have multiple surgeries. I'm not going anywhere. If you, your colleague recommend me, if you can do it, I trust you do it. And that was my biggest fear. So, okay, young female, anterior area, trusting me to that. Can I deliver this or not? And luckily, I conquered this fear. And I say luckily, but with all of the like a training and then hardship that I managed to do that. But still, I'm waiting for a moment to say that, okay, can I conquer this? But I know my limitation. I never try anything on patient just for sake of like trying. And if I know that I'm crossing my limitation, I always have people to refer. But yeah, going back to question, I think that was always like, see that, find your limitations or try to improve yourself, to learn more, and still learning every day to come across with your limitations and progress and get better in what you're doing.
So what would be your advice, extrapolating from this question, to those young dentists, female dentists that are just finishing now, let's say, Eastman prosthodontic or implant program, and they're going into real world? What do you advise them when they are not sure about what to choose?
I would tell them, first of all, trust on yourself. So you had your training. First of all, you need to have a basic training. Know everything's basic right. And then don't be scared. Don't wait to be invited. Just step in. Don't wait for the right moment. Right moment is right here. You need right now. Do it. If you wait for it, you never find the right moment. Just don't be scared. Go to the wide world and have the right mentor help you. There are loads of people around, they can help you. You don't need to specifically put the name of mentor. You can learn from lots of people. Even you can learn from your patients. communication with patients. We can learn from different clinicians, different aspects of the treatment, and just do it. If you don't do it, you never will do it. And I have lots of people like, okay, I'm not sure I've done this part, but I'm not sure I can just I said, I'm here over the phone. Just you need me, just call me. I need you do it because it makes me so happy. I say that doesn't matter male or female that they learn, continue doing that. But I will be more happy with female because I know that's
It's more difficult for them.
Yeah, more difficult for them. And some of them, they bring the excuse, for example, I have family, I have children. So they are not excuse because you can adapt your professional life around your personal life. Even male, they have the family. Okay.
The same way as a male.
Yeah. So it's not a barrier to be a mom or to be a wife or
to be a top implant dentist.
Yes, top implants. Because I know lots of top female implant dentists. They have family. They look after their elderly parents. They look after their children. But still, they manage to be on top of their game in the implant dentistry or the surgery as well. So there is no excuse. There is no barrier. Just you need to have this courage and do it and have the right people around you to help you if you need so.
Oh, fantastic. So let's hope that in 10 years from now, we'll have many more females, dentists, implant dentists,
Definitely, I think that is
in the industry.
Mm-hmm.
And for those that will listen to this podcast, I hope that the ladies, the females that will listen to it will feel inspired by your story.
I hope so.
And will take the leap of faith and join the industry, join the implant dentistry. Safa, this was a truly inspirational conversation with you, and let's hope that in 10 years from now, we'll see more females entering the industry, entering the dental implant industry. They'll be more confident and we'll see more of them. And for those listening, if you want support, if you want mentorship from Safa, please find her online. She's a clinical lecturer at Eastman Dental Institute. And get in touch with her. She'll be very happy to help. And I hope that
definitely, I'm so passionate about female that they grow, and I will be so happy to help any female if I don't know of them. If they need any advice, any help, I'm more than happy. And I want to support females and see them they grow and become the best version of themselves.
That's truly amazing, and thank you very much for doing this.
You're welcome.
And I hope to see you in another episode. Thank you very much and have a nice day.
Thank you.
Bye-bye.